So hello, everyone. My name is Erica Zerzin, and I am the Public Awareness Coordinator here at the Alzheimer Society of Saskatchewan. And it is my pleasure to welcome you all to our community conversation discussing the findings from the Alzheimer Society of Canada's landmark study. We have two experts here today, Dr. Joshua Armstrong and Joanne Bracken, to share an overview of this study and explain how the findings impact the work of the Alzheimer Society of Saskatchewan. I just want to remind everyone that this event is being recorded and it will be available to watch online later. Only the presenters will be shown on video, not the participants' names or videos. For questions, please use the Q&A function at the bottom of your screen during the presentation, and we will go over all the questions at the end. We ask that you please keep your questions relevant to the presentation. And if you have any questions regarding dementia that's not relevant to the discussion, please contact our offices or call our dementia helpline at 1-877-949-4141. I want to start with a land acknowledgement from a Saskatchewan perspective, since we are a provincial organization. The people of the Alzheimer Society of Saskatchewan are privileged to live and work across the traditionally sacred land we now know as Saskatchewan. We recognize the enduring presence of the Cree, Dakota, Dene, Nakota, Lakota, and Saulteaux and Métis people, who are the original stewards of the rolling hills, rushing rivers, and living sky we all share today. As an organization, we acknowledge the harms of the past and how Indigenous people are still impacted by the process of colonization. Through partnership, education, and collective action, we commit to honoring our relationship to the land, our treaties, and to each other as we journey towards Wekotehisiwin, which is reconciliation in Cree. So our discussion today on the findings from the Alzheimer Society of Canada's landmark study comes after the recent release of the second report, the Many Faces of Dementia. This looks into the diversity of dementia in Canada. So these reports use data to project the future of dementia in Canada, but I want to let our speakers tell you all about these findings. So I'm happy to introduce to you our panelists for today. We have Joanne Bracken, who is the Chief Executive Officer of the Alzheimer Society of Saskatchewan. Joanne has dedicated the last 35 years to improving the lives of people living with dementia. 23 of those have been at the Alzheimer Society of Saskatchewan. And over her career, Joanne has expanded the services to support people living with different types of dementia, creating the Alzheimer Society of Saskatchewan's first support groups for people living with dementia, and oversaw the opening of 7 resource centers located across Saskatchewan that now provide support to 2,700 individuals for more than 300 communities, And Dr. Joshua Armstrong, who is a research scientist at the Alzheimer Society of Canada. Josh completed his PhD in Aging, Health, and Wellbeing at the University of Waterloo in the School of Public Health and Health Systems in 2013. After receiving his doctorate, he went on to complete the Alzheimer Society Research Program postdoctoral fellowship with the Geriatric Medicine Research Group at Dalhousie University. His postdoctoral research work used advanced analytic approaches and data from large population-based cohort studies to examine the relationship between frailty and cognitive decline in older adults. So thank you both for being here today.
Thank you.
So let's begin with telling attendees about the landmark study. What are the different parts being released and what are they telling us?
Sure. So the landmark study is some work that we've done with another group, the Canadian Centre for Economic Analysis. With them, we've used their modeling approach to build a simulation of the Canadian population so we can understand how the population might change over the next 30 years. And onto that, we layered on different rates of health characteristics, including dementia, to try to get an understanding of what dementia will look like over a 30-year time period from 2020 to 2050. We call this a micro-simulation approach. It accounts for things like immigration and changes in the population. With this data that we've generated, We've created we're going to create 3 reports from it. The first report was looking at the projections primarily, so looking at what to expect in terms of dementia numbers in Canada and across all the provinces for the next 30 years. So we're seeing an increase from around 600,000 in 2020 up to 1.7 million in 2050. That report also had a chapter on care partners, so looking at the responsibility and the role that people who provide care to people living with dementia, and the extreme amount of work that they do across Canada for those with the condition. We also had a chapter on risk reduction, so how can we reduce our own risk and our risk across the population when it comes to dementia. And then just recently, just back in January, we released a second report. So where the first report really was focused on numbers and statistics and big projections, we wanted to break that down and look at the people who are experiencing dementia. So putting a face to those numbers, for example. So we looked at across different population groups, and we were hoping to follow up that second report with a third report where we then layer on economic data to the model. So not only do we know how many people will be experiencing dementia over the 30-year time period if the current trends prevail, but also how much will that cost in terms of long-term care, hospital use, home care, and also the costs that where people have to leave their work to provide care to one of their loved ones, and other aspects as well.
And I think just from the Saskatchewan perspective, you know, that first study was the Rising Tide report was released in 2010. And so this was an opportunity to update those numbers and to really have a look. So from the Saskatchewan perspective, we know there's going to be a 142% increase in the number of people living in our province with dementia. So from about 20,000 people to over 42,000 people. So we know the numbers are growing. And as Josh said, that initial report too really talked about how dementia affects care partners. And we know that on average, people spend about 26 hours caring for people with dementia. And, you know, there's a cost to that care. So, you know, there was some comparisons to the number of jobs that would equate to. And so we know that I talk about how care partners are that really important structure that's really helping to support our healthcare system. And I think that report using some comparables about what they would be paid in minimum wages, really to demonstrate the impact that care partners have. And the other really important aspect and really highlighted in that first report was the impact of prevention, and you know, the fact that 40% of dementias can be prevented, and that would make a big difference for the number of people living with dementia across the province. So that was another really important aspect of that report that I think Alzheimer societies, individuals, governments will be challenged to really take advantage of that to make a potential huge impact on the impact dementia will have for people with the disease, our economy, and our society.
Yeah, these reports really put the state of dementia into perspective for everybody.
Absolutely.
So what are the key findings in these reports?
Well, I think I have the second report at the top of mind, so I'll start there. We can go back into the first report too if people are interested. Second report focusing on the people. It's called the Many Faces of Dementia in Canada, really focusing on who might be experiencing dementia in Canada over that 30-year time period. So 4 key topics, but there are other issues brought up as well. But dementia in Indigenous populations, differences in dementia across different ethnicities, differences between sex and gender, and then young onset dementia. So for Indigenous populations, expected an increase across Canada. I can't remember the exact percentage off the top of my head, but almost quadrupling the numbers. This is primarily driven by the aging of the population. We often think of Indigenous populations as being younger, but we're having a growing number of individuals over the age of 65. And with age being the strongest risk factor for dementia, we expect to see an increase in Indigenous people living with dementia. Well, age is the primary driver of that, but we have to also think about other reasons why we might see higher numbers within Indigenous populations. So the report gets into social determinants of health and the impact of colonization, how that plays a role in a lot of dementia risk factors in the population. The second chapter, when we focus on differences in ethnicity, the chapter gets into all the background. Well, one of the findings that we share is that when you look across multiple studies from the UK, from the US, often see differences in risk of dementia across different ethnic groups. Not really a good understanding of why that is, but it's consistently found. So knowing that, we wanted to look at this data and what are we going to see within our study? And when we look at our study, we do find some things. It's not really driven by these differences in risk across groups, but that's accounted for. But what's really driving what we find in our study is the different demographics across these different population groups. If you look at the history of Canada and immigration trends, back in the 1970s, we saw a shift in where people were coming from to Canada, a larger amount of immigration from Asian countries. So that was about 50 years ago that we saw this shift. Now we're starting to see people that came over in the 70s and 80s get into their older years and then increasing the risk of dementia. So one of the key findings from this chapter is that we're expecting the number of people living with dementia of Asian descent, so from East Asia or South Asia, to fairly rapidly increase across the country. I think this holds true for Saskatchewan, but it's true across most provinces. So with the Canadian data, it's going from about 8% of people living with dementia in 2020 are of Asian origin to 2050, where it's almost 1 in 4 people living with dementia in Canada will be of Asian descent. So that really means we have to tailor our programming and services to try to meet the needs of this changing demographic. The third chapter, sex and gender. So if we look at data from around the globe, we consistently find that women are affected much more so than men when it comes to dementia rates. So across most westernized countries, for every 3 diagnoses of dementia, 2 of them often go to women. So about 66%, maybe a bit lower, but that ballpark figure is consistently reported. So why is that? We get into that within the chapter. Some of it's attributed to the fact that women live longer than men, and in average in Canada, women live 4 years longer than men, with age being the strongest risk factor. That might drive some of those numbers up. It would be great if the story ended there and it was simple, but it's much more complex than that. If we start to dig into differences in sex and gender across the life course, you see a range of factors that might drive risk across, and differences in risk across men and women, males and females. So we get into that a lot in that chapter. And then the fourth chapter or fourth topic was young onset dementia. Young onset dementia is a term that's used for people that develop dementia under the age of 65. And these individuals have many unique needs due to the time in the life course where they're impacted. We expect to see these numbers increase as well, but not as drastically as maybe for the general numbers, because it's not really driven by the age of population. It's driven by increases in our population. We expect to see a growing number of people who develop dementia prior to the age of 65. So that is the second report in a nutshell. It's probably a lot to take in, especially because I don't have my slides and my illustrations and graphics to share, but please do check out the report to get all those details.
Yeah, it's a very lengthy report. I have mine here, and there's a lot of information about it. Joanne, do you want to tell us kind of the key findings from a Saskatchewan perspective?
Yeah, just echoing Josh's comments. So certainly we will see significant increases, especially people with Asian origin in Saskatchewan. Our numbers here are expected to increase by 2,500%. And so that is a huge change in that group of people. And then again, across Indigenous populations, a 255% increase, and in the African population, a 260% increase. So the face of dementia is changing, as Josh said, really related to immigration. And then as well, too, the number of women who have dementia. I mean, certainly we've been talking about that for a long time. And I've often thought about dementia as a women's disease because they're more likely to get the disease and they're more likely to be care partners. And so the impact on women is really reinforced in both of these reports. And so just really understanding that and thinking about that in how we make decisions moving forward. And then also as well to the younger age groups that are experiencing dementia. And, you know, when we did the Rising Tide report in 2010, we really didn't talk about this, and we didn't have a lot of data on the numbers. And I think Josh would echo, I mean, those numbers will probably change as we learn more about how dementia affects younger populations. And from an Alzheimer Society perspective, we know that their experience with the disease is very different. It takes a longer time for them to get a diagnosis. You know, and for the average person in Saskatchewan, it can be up to 18 months to get a diagnosis, and it can be years for somebody who's younger, because we don't suspect that it would be dementia because age is the greatest risk factor. And then often, you know, they're still working, so are they able to continue work in the workplace with dementia? You know, I starting to see some improvements in that area, but that's another area that we need to think about. Often, you know, if they can't work, loss of income, young children at home, young children becoming care partners. And so it really affects younger people in a much bigger way. And then as well, a lot of the services are tailored to older people living with the disease. And so when we've talked to people living with dementia, they talk about a gap in social programming and resources and supports that really meet their needs. So I think that will cause us to think differently as well too about how we address dementia moving forward for younger people who are affected by this disease.
Yeah, thank you. So why are the differences in dementia important to know? Like, how do cultural and demographic differences affect people's experience with dementia?
It's a big question. I think that one that we're all trying to wrap our heads around and try to figure out how do we work, how do we deal with this. So one of the reasons why it's important is I think you can start with language. That's often where people go. Like, do we have resources in the right languages for populations that don't speak English or French? But I think we need to go much beyond that. There's different understandings of dementia across different cultures. Stigma is a big thing across different cultures too, and the way people think about dementia. So trying to address stigma differently, and even just having resources that reflect the culture of people would be helpful, especially when we're thinking about an area like a risk reduction or prevention. Having activities that are culturally appropriate is going to have a much greater impact and maybe be taken up much more than if you just had some sort of generalized exercises that you might want to share. So there are these differences, and I think it's when we're thinking about trying to help people living with dementia, taking a one-size-fits-all approach doesn't work. There's this famous saying like, once you met with one person with dementia, you met one person with dementia. So we're all unique, and everyone has a unique experience with dementia. But when we step back and we look at across the population, there are similarities and differences across people that we can work with and tailor our programs and services to optimize them to meet the needs of the individuals with the condition and their care partners. So I think it's important to kind of think about all the nuances and the personal characteristics that have an impact on the needs of these individuals, and then try to design our systems of support to match those needs.
So these reports have broken down the different risk factors for dementia. You kind of already touched on it, but can you elaborate more on these findings and the impact of the social determinants of health?
Sure, yeah. So there's a range. For a long time, we didn't think we could do anything about dementia. It had to do with aging. So there's nothing you could do. We all are going to get older. So just give up and let's get dementia. But that's not at all true. That's completely false. Over the past 20 or so years, we've really developed our understanding of what are the associations with risk of developing dementia. Still don't fully understand the full mechanisms, why exactly an individual might develop a condition really that leads to dementia. But there's a much greater understanding of the risk factors that lead to it. So risk factor is anything that's known to be associated with increased risk across a whole population. Often within the dementia space, you'll hear talk of this Lancet report, Lancet 2020, where they really highlight some of the factors related to dementia prevention. They had like 12 factors. These 12 factors, if we could address all of them across the population, that's where you get that 40% of dementia could be stopped if we are able to address those 12 risk factors. So those 12 risk factors are things like sleep, hearing loss. Actually, sleep's not even on that list. Sleep is on the list though. Hearing loss, brain injury, smoking, drinking, exercise, obesity, hypertension, social isolation, air pollution, diabetes. I think I might have got them all, but yeah, the Lancet 12. Those are 12 well-studied risk factors. But the list of actual risk factors for dementia is continuing to grow. Things like sleep are on it, other environmental toxins, different aspects related to heart health, and the list continues. So there's lots of things that we could do to impact our health and our brain health that would reduce our risk of dementia. So all these factors that I talked about, these are all kind of at the individual level, things that we can do as an individual, but we need to recognize that not everyone has the resources and capabilities to directly impact their health. So that's where we need to get into the social determinants of health. This is the context in which people live. And social determinants of health are these non-medical factors that impact health outcomes across a population. So things like socioeconomic status, housing, education, indigeneity, and the list goes on. I think there's 17 listed in Canada. There's different lists you can find, but it's important to recognize that none of us live in this on an island by ourselves and have certain health behaviors that are just dictated by our own will. We live within a context, and we have resources, and we have relationships, and that really drives a lot of what happens in terms of our health. So it's important to recognize that fact that we can't just give information to people to try to have them do something about their health risk. We need to work as a collective and create policies, programs, adjust laws to try to improve the brain health of all Canadians, and then reduce these numbers that we have projected with the simulation model. Hopefully that answers your question.
Yeah, I think the other thing that's important about that is, I think, that 40% of dementias can be prevented seems to be breaking news for a lot of people. We did some polling here in Saskatchewan, and less than a third of people were aware of brain health or could name any strategies to reduce their risk. So I think there's a lot of education that needs to happen, and not just with the general public, but also with our governments and people who can set those policy standards and make the difference. And as well too, it's about delaying when people get dementia. And, if you can delay it by a few years, it makes a huge impact in the number of people. And I think with our governments, that's what they're interested in is, if we could delay this, if it helps people to stay in their homes longer, reduces the number of people who need access to long-term care facilities. I mean, those are important health policies for the government to be considering. And then, as you say, our ability to act on those risk factors isn't equal across the population. And so how do we address some of those social determinants of health to support people who are more vulnerable and at risk to develop dementia, so that there's equity in how we can address dementia across the country.
For sure, that 40% number, that's a global number from 2020. So that's a worldwide data. What is in Canada? I've seen some estimates. I know some people are working on publications related to this, but it's expected to be a little bit higher in Canada because it's a function of those risk factors and how prevalent they are, or how commonly they occur within a population, and then related to how much risk that's associated with for dementia. So if we were to look at Saskatchewan, we could maybe look at what are the risk factors in Saskatchewan that are having the greatest impact on dementia risk, maybe tailor supports or programs to try to lower that. For example, maybe it's diabetes. Maybe then we could enhance diabetes care, and maybe then could lower the risk within Saskatchewan. I know the Lancet is coming up with a new report probably this next summer, so we'll see an update to those numbers as well, and maybe an update to those list of key modifiable risk factors. But that list is always growing. The Lancet only uses ones that have the best data for a global population.
One of the other things that I've heard as well too is countries who have had dementia strategies for 30 years are actually seeing a decline in the number of people with dementia. So I think that also can demonstrate the importance of having a dementia strategy and then funding that strategy so we can implement some of the changes in it. But if we put our mind to making change and we put targets to address, I think then there's a bigger chance that we're going to have an impact from some of the calls to action in our dementia strategies. And I know that prevention and lowering the risk is a definite call to action in the Canadian strategy.
For sure. We actually, if we look at the data around the world, we have actually seen a reduction in dementia rates. So age-specific dementia rates across many different populations, we've actually seen a bit of a reduction. So it's not that dementia is getting worse. What's really driving, at least the numbers in our study, up is that we have this aging population, a growing number of people over the age of 75. It's going to have an impact on the number of people living with dementia. So right now, baby boomers are getting up in their late 70s, and within the next 20 years, they'll all be over the age of 80, and then that's going to have an impact on dementia rates, even though we've seen the dementia rates getting better. And dementia rates have seemed to get better because we have better heart care, heart health, better physical activity, better education for our seniors. So all these things will play a role in dementia rates across the country. But it's important to recognize that things have gotten better, and we've accounted for that. Was one of the reasons why we did this new study, was to try to account for these changing trends. But like I said, with the growing population of people over the age of 75, we're going to still have dementia is still going to be an issue. So we really need to, I think, continue to work at it and figure out how to not only work on prevention, but also how can we best support those people living with dementia and their care partners.
Yeah, thank you. We talk about those modifiable risk factors and the actions that you can take for them a lot here at the Alzheimer Society of Saskatchewan. So hearing that there's more research coming out on that is really exciting. And if anyone does want some more information on that, you can visit our website. And we do host presentations on risk reduction actions regularly. So what does the study recommend we do about these projected rise in dementia cases?
There's a lot of recommendations within the two reports, like probably around 100. I should have counted them up beforehand. So there's a lot of things to do. The way we organize the recommendations is in the first report, it's by the different lenses. So you have what can we, the Alzheimer societies, do better to try to support people living with dementia, but then also what can healthcare systems do? What can the federal government do? What can the provincial governments do? What can municipal governments do? What can researchers do? And in the first report, we also said, what can individuals do to prove it? Because we all have a role to play at the individual level, and then also through our roles within society, whatever they be. The second report, we used those same kind of lenses. We didn't look at individuals, but we looked at those different topics. So Indigenous populations, differences in ethnicity, differences in sex and gender, and differences in young onset dementia. So lots of recommendations, because this is a complex issue. There's not one, people always ask me, what's the one thing you could do to solve this problem? Like, I wish it was that simple, but it's complex. A lot of it, as a researcher, I'm also just going to say lots of research needs to get done, better data collection on people living with dementia in Canada, better understanding of who has it now, and also how the trends are changing over time. Like what we did was a simulation study using available data, but it's not real data. It's not the actual surveillance of people living with dementia in Canada. This is a topic that's being worked on by the Public Health Agency of Canada. It's a challenging topic. It might sound fairly simple, as simple accounting people. It's not that simple at all. for a range of reasons I won't get into. So surveillance, but also having better data across the population, so better understanding who's getting dementia, what are their needs, how can we better support them. We call for more collection of race-based data. So if we don't collect data across different races or ethnicities, we don't know if there are differences or not. That hasn't really been done very well in Canada. So hopefully that is changing in some jurisdictions, but hopefully we'll see an increase in collection of that kind of information. And the list could go on. So there's definitely a ton of recommendations within the report. I'm sure, Joanne, you might have some that you want to highlight from the reports.
Yeah, I agree with you. I think just lots of data collection, lots of understanding. And some of the lack of data is related to lack of involvement of different racial groups in research. And so, and then what are the research questions that they want to be solved? And so I think just really engaging communities in the work that we do. I think that will make a difference. And as well, I think involving, broadening the diversity of the Alzheimer Society family, and calling on people to help us to advocate to governments. One of the things I really like in the study is it shares stories from people and their perspectives. And I think there's a lot of power in people talking to elected officials about how dementia is impacting them. So I think in a way, we just need to be open and more engaging of the diverse communities that we're serving in the work of the Alzheimer Society.
Yeah, we focus a lot on how community can change everything here. So Joanne, how can communities prepare for these projected increases in dementia?
Yeah, so I think one of the most important things we need to remember is that people living with dementia live in communities. I think there's this perspective or perception that when you get dementia, you right away move to long-term care. And over 60% of people with dementia live in our communities. They're your neighbors, they're your friends. I mean, they're the people that you meet each and every day within the community. And so we need to really learn about dementia. When we started our Dementia Friendly Communities program, we asked people with dementia, what would make the biggest difference for you living in your community to have a high quality of life and to reduce the isolation that you feel and to help you feel more engaged in the community. And the number one thing that they said is people need to learn about dementia. They need to understand what it is. And, we can reduce some of that stigma. A lot of the stories I've heard is someone gets diagnosed with dementia and they start to lose their friends and their social circles. And so I think it's really important that people learn about dementia. And I don't think it's intentional that people fall away. I think it's that they're worried they're going to say something wrong or they don't know exactly how to support the person. So that is really important, to learn about dementia and how you can help support people living with dementia in their communities. That will help create inclusive and welcoming spaces. And that's really, really important. I think the other thing that at the community level we need to think about is, again, we talk to people about living with dementia and they want to stay in their communities as long as possible. I know here in Saskatchewan, it's the priority of the Ministry of Health to help people stay in their homes as long as possible. And I think what we really need to start thinking about is what are the supports and the resources that need to be available to them. So in Saskatchewan, we heard education about dementia, education about responsive behaviors, access to adult day support programs, home care and respite. And again, that ties into the effect on care partners. So if we want people to stay at home, those care partners need to have the resources and supports available. And when we did our awareness day in the Saskatchewan legislature, one of the stories was of a family who they've been waiting over a year for access to an adult day support program. And so if people are going to stay at home and live well, the resources and supports need to be there. And then the lens of diversity on top of that, are those supports culturally sensitive? our caregivers trained to deliver services that meet the diverse needs of people living with dementia. And so the healthcare system needs to respond to that in a way that makes sure that when we do have those services available, that they're culturally appropriate for the people who need them. So those are a few things that I think about from the community level that we can be doing, and just really empowering people to live well. And it's about knowledge and appropriate resources, the availability of the resources, and then making sure that they're culturally relevant to the people who need them.
I agree. Like, the knowledge is such an important thing. That's we live and breathe Alzheimer's and dementia every day, and we don't. I don't. It's easy to not recognize that not everyone thinks about it so much. So talking with people, sharing information, myself, but also once I'm hoping that people will learn from the reports and then be able to share that with people. So it's less of a scary condition. Like, it's definitely a challenge if you have dementia, but if you know a bit about what it is and what the expected path might be, that might reduce some of that fear a little bit and reduce the stigma. And then you're right, Joanna, people do tend to kind of step back because they don't know how to deal with it. If we had education about what it is and how to support people, that might improve that community response to people living with dementia.
I know for us too, we talk about, people who get access to resources and supports have a very different experience with the disease. And so through our First Link program, if people are directly referred at the time of diagnosis, on average, they get to resources and supports 11 months sooner than those who find us on their own. Often people who self-refer to the Alzheimer Society, once they're here and they've accessed our services, they can name 2 or 3 things that they think they could have avoided had they had access to that information earlier. But stigma is still such a big issue with this disease. And so, and I think that comes from people talking about it and sharing their stories and their experiences. So lots more work for us to do.
Yeah, thank you both for that. Well, and speaking of work that we need to do, how will this report impact the work that we are doing at the Alzheimer Society going forward?
Yeah, so I mean, certainly we've been thinking about this and talking about it. Our board has had a priority around diversity, equity, and inclusion for the last 3 years, and we've just had another strategic planning session and a report. And so, being able to serve diverse populations remains a priority for the Alzheimer Society. So there is that commitment there. Our board has a position statement on diversity, equity, and inclusion. As we developed our strategy, one of the priorities in the board position statement is that we need to reach out to these diverse communities to ask them about their needs, so that that can be part of what we're thinking about when we're addressing this. So we did broad community consultations in developing our strategy. We reached out to the 2S LGBTQ2I+ community. We reached out to New Canadians. We reached out to Indigenous communities. And a lot of it was, I think the many faces of dementia being articulated through their stories about lack of trust in the healthcare system, lack of appropriate care, people being sensitive in the community and being responsive to them, but it's about fitting into what's there. It's not about services that are specifically designed to meet their needs. So they talk to us about that importance. Collecting data, even at a organizational level. So if the board asked me about the different diverse communities that we served, a year ago, I couldn't answer that because we weren't collecting the data. And all across Canada, we've started to collect data about the different diverse communities that we're serving. And so we can measure that. We can see if we're making a difference. And if we aren't, then we can challenge ourselves to go back and talk about what do we need to continue to do differently. We're also educating our staff about working with different populations and, engaging people from the Indigenous community to help us learn about truth and reconciliation and treaties, starting to work with diverse groups and doing training on unconscious bias and anti-racism so that our staff are better able to understand and to learn. And we have a lot of learning to do, and we're very early in this journey, but we're starting to really commit to this work and embrace it. And I know that we're going to make mistakes. We have a lot of unlearning to do. We're going to do things that people are going to challenge us on, and we're going to have to think about it and do differently. But I think it's about starting to have conversations with the diverse groups and to talk to them about what do they need and how do they get engaged in the work of the Alzheimer Society, getting them involved in our board of directors and making them feel welcome to apply for jobs within the Alzheimer Society. And I think all of those changes will start to make a difference in how we can commit to better serving the more diverse populations living across our province.
Josh, does it impact the work that you know about the Alzheimer Society of Canada as well? Or what are your hopes that it'll do?
It's still early days. We're still doing work, building out communications about the report. We will see how this kind of changes. I'm so happy to hear that like it's influencing change in Saskatchewan. I do talk to my colleagues and like, how do we follow this up? How do we build off this work? Really what motivated the report itself was just kind of a review of the science and then what does the data tell us? So it was not really an advocacy document, more so just like let's review the data and share what is found across the literature. But now like what's the next steps? How do we build upon this? That's what we really need to figure out. I don't have all the answers. I hope to work with the societies across the country to try to learn how can we support the work that they do, how can we get better data to try to inform the services that we provide so that we can improve things. Excuse me. It's complex. There's a lot of diversity. We see the diversity in Canada, but then we're seeing a growing diversity in older adults, growing diversity in people living with dementia. So how do we best tailor our needs? I think it's through kind of like this design thinking, understanding the needs. Somehow we have to figure out what those needs are and then design our services to kind of support them. So in order to do that design aspect, we need data. I am a data nerd, so that's why I kind of keep going back to the research and data side of things. But I think, yeah, lots of work to be done. We don't have all the answers right now, but we need to work to kind of figure it out and how can we best support all people living with dementia in Canada.
Well, and the findings have told us that we need those communities to tell us the actions forward and what they need, because we can't decide that for them, right? So.
Yeah, so it's like really getting people involved in communication and it's like it's education again, right? We're talking about dementia, communicating what it is, and then hopefully we'll enhance dialogue and really learn how can we best move forward if we expect these trends to continue. Hopefully we can actually reverse the trends and lower the numbers that we're seeing through prevention and risk reduction across the populations.
And then in addition to that too, I think it's access, and you touched on this earlier, Josh, just having information available in different languages and, those, and some of our, the Alzheimer Society of Ontario and BC are doing a fantastic job of that as well too. And so willing to share those resources. So I think it's about preventing in the future, lowering that number, and then making sure the people who are living with dementia today have access to culturally sensitive resources soon and early, and that they can live well with this disease.
It's not a Alzheimer Society resource, but have you guys seen Forward with Dementia? It's comes out of I think Ontario, but it has a bunch of different cultural resources on it. Just newly came out recently. It's awesome. So yeah, forwardwithdementia.ca I believe is the website. So I think there's Italian, Hindi, all sorts of Chinese, all sorts of different languages and resources that are culturally appropriate, designed by people within those communities. Yeah, cool, great resource. But and more will be developed too. There's Indigenous resources that have been developed more recently, and then we'll hopefully continue to see this grow and have. It's not just about language; it's about also about culture too, and having
Absolutely.
people's faces reflected within the brochures too. That's one thing I always hear one of my colleagues talk about how she would never see herself or her family within any of the materials. So having that shift too can something as simple as just the imagery can have an impact on people as well.
Absolutely. Absolutely.
Yeah, and I can send out that Forward with Dementia website and those Indigenous resources that you mentioned, Josh, because we do use those sometimes in our community engagement. We have talked with some newcomer welcome centers across Saskatchewan and intend to engage them more to kind of understand what they need from us and what we could be capable of doing to better support those communities. And language was something that has already come up. So that's awesome that you mentioned that. Well, if anyone has any questions that is attending for our panelists, we welcome you to put them in the Q&A now so we can get to those. Been some comments so far. Knowledge empowers people. And thank you, Joanne, for saying the Alzheimer Society of Saskatchewan is prepared to respond and positively receive challenges from the diverse populations we are serving and then hopefully improve what we do. This needs to transfer to the SHA. They say they are person-centered, so they also need to be more diversified. So, I mean, hopefully this information does spread across to different organizations as well, obviously. So it's not just an Alzheimer Society resource.
But that's the one thing that we try to do a lot at Alzheimer Society as well, is try to educate not just the public, but also health providers too. So building materials to specifically support health providers. One major project that we're working on within the Alzheimer Society of Canada is this National Dementia Guidelines program. So how can we support family physicians in their care? So the first topic we're focusing on is communicating a diagnosis. And we've done that general kind of approach, but then we've also created different groups to take more of a cultural approach too. What are the cultural nuances we need to consider when delivering a diagnosis? So that's just to support family physicians, but that we can continue to build other materials too to support healthcare providers across the country and working with people with dementia and from different cultures as well.
Yeah, there are a lot of opportunities within this, definitely. So I don't know how familiar you are with each kind of generation of increases, but do you know the prediction for the increase or decrease in dementia for the post-boomer generation?
Don't know if we have like information generation by generation, right? A lot of it goes on trends. It's important to think about different generations or cohorts because everyone has different impacts, right? One thing I've talked about is like, with some of my people my age is, will we still see the differences in sex for our generation compared to other generations? Because when I look at my generation, females more than males take on those complex jobs. So maybe that's going to have an impact on brain health in late life. So yeah, we can assume all these things, but we don't really know the data or the risk for people of different generations. We can only hope that this information gets out. People actively work on their brain health and try to reduce their risk overall. Hard to predict the future. You never really want to do it. Things like obesity rates and COVID are obviously going to have a negative impact on brains. We don't know how that might influence outcomes down the road. What we've done within the model is just taken current trends and kind of apply them to what we expect the population to change going forward. Hopefully those trends we can actually reduce, so we don't actually even see the drastic increase that's projected. But only time will tell whether those projections will come true or if we can shift those curves downwards.
Just one of the reports I saw recently talked about like physical activity rates for Saskatchewan are lower than national average. Obesity rates are higher than national average. We drink more alcohol than the national average. We smoke more. And so the time to start thinking about your brain health is now when you're younger. And I just think from from, you know, a health data perspective and some of that data that they measure about, you know, what we're doing, it doesn't tell a really good story for Saskatchewan. So I think we need to really think about, you know, changing what we're doing so that we can change those numbers, because in a lot of ways we're behind some of the other provinces in that, well, behind, we're on the wrong end of some of that data across Canada. So I think we need to think about that. And yeah, just brain health is important to think about. You know, age is the greatest risk factor, but the sooner you can start addressing some of those factors, and also not just one factor, but it's the combination of the factors that is really the sweet spot. So as many of those risk factors that you can address, the better your outcome should be.
Yeah.
Totally agree.
And as a millennial, we are the fastest growing population in Canada due to immigration and all of that as well. So brain health is super important in this age group, as some symptoms can start as early as your 40s, right? So that's the millennial generation. So I mean, it's the younger you can start looking after your health, obviously, the better. And yeah, so what would you say would be the best way for us to share out these resources with other organizations and groups?
Well, both the studies, the reports can be found online. They're kind of long, I guess, though. So finding short forms or just talking about dementia more might be important. But you can start with sharing a link to the studies. For me, that would be great. Joanne might have a better answer than that.
Yeah, so certainly with the first report and starting to do so with the second report is just, you know, for example, I've sent it to groups of researchers just to say you might be interested in this report. I've sent it to the Ministry of Health. I have yet to send it to our Minister of Health and Minister of Rural and Remote Health. But again, it's just making sure it's in the right hands of people who needs at the SHA, who needs to have their hands on this report. And it's sharing it out and then encouraging them to share the report so that, again, it's a huge issue. There's hundreds of recommendations in there at all different levels of government and, you know, even municipalities, and thinking about how do we plan our cities in the future. So there's lots of different ways that we can share this. And I think, and it doesn't have to be the Alzheimer Society that shares it. You know, if you have somebody that you want to share it with, you know, go to the Alzheimer Society website or contact us here at the Alzheimer Society, and we can send some of the provincial data as well, so that you can circulate that to people who you think might be interested in exploring this data and thinking about solutions.
Yeah, and that's why we're having this conversation today, to bring different communities and different organizations together and spread that knowledge. So and I know the answer to this next question, but Joanne, I'm going to pass it off to you. Does the Alzheimer Society support people with all types of dementia or only Alzheimer's?
Thanks, Erica. Yeah, we are called the Alzheimer Society, but we do support people with all different types of dementia. And so, again, if you need help or support, give us a call on the helpline at 1-877-949-4141, and we'd be happy to help people with various types of dementia. And we have lots of information on the different types of dementia as well.
Yeah, just looking, we got quite a few questions in here, so.
When it comes to those categories, one thing that the research is showing is that after like the age of 75, most people have mixed pathology. So not just one type of dementia. So Alzheimer's disease, that's pathology that's thought to cause the majority of dementia. But there are other types of Alzheimer's or other types of dementia, vascular dementia, Lewy body dementia. But when you get over the age of 75, it's usually you're going to have a mix of all different types of pathology. So using that one label maybe is not the best way to do it. We use it because it's related to the symptoms, and we have a whole system to kind of track things. But it's good to understand that once you get into late life, people are impacted by multiple types of brain pathology. And that has the greatest impact, not just one type of pathology. So again, just reflecting back to this idea of brain health and taking an active role in prevention. I think that the better you do in terms of your overall health and brain health, the better outcomes you'll have. That can even be said for people living with dementia. If you're active and working towards improving your brain health, even if you have dementia, you're still going to have better outcomes. So it's important to not to stop at any time. Always be thinking about how can we improve our brains.
That's well said. And so this is a little bit of a longer explanation and a question, but as employment in the healthcare system grows to accommodate the increased demand, we will continue to see increasing diversity in these newly employed care providers. This would increase the need for training so that the standard of care and safety are maintained. So is this addressed in the study?
Not directly. We probably talked about training in different ways in terms of educating people about diversity and dementia. So we do probably highlighted that in the recommendations, but we don't really get into that deeply within the content itself.
Yeah, that need for cultural safety and understanding, definitely.
Yeah, it's all highlighted in the recommendations.
Mhm. Okay. A lot of thank yous and nice comments. Does anyone else have any questions? We are nearing the end here, so any final comments or questions are welcome. And if you haven't seen in the chat, we have been posting some of the links that we have been talking about, and we will send them out in a follow-up as well as a survey to kind of get any follow-up questions or last comments as well.
There's a question in there about brain health being included in high school curriculum. I don't know, but I'm guessing probably not. Actually, pretty shocked you don't really see a lot of material in even public health units about dementia and dementia prevention, partly because it's kind of a new. It's in the last few decades that we've seen this major shift. So someone needs to work on writing curriculum and developing textbooks that cover that at high school, but also within university levels as well. So there's more people learning about it and be exposed to it, and then you have more practitioners that are able to work in health promotion field that has specific knowledge of brain health and dementia reduction approaches. I think it's important.
A little out of the scope. There are some raised hands, so if anyone does have any final questions, please you can type them in the Q&A. But if you do have any follow-up questions after this presentation or your question didn't get answered, you can follow up with me by email and I can make sure they get to the right person. Or of course, like Joanne has mentioned as well, you can give our dementia helpline a call at 1-877-949-4141. And we have posted that number in the chat.